Hi, I am Melissa Hunt Havertz, and in this presentation I will be discussing the eating disorder Anorexia Nervosa. Eating disorders are serious emotional and physical problems related to persistent eating behaviors that can have life-threatening consequences. There are three kinds of eating disorders that require immediate medical and psychological help. One of these is anorexia nervosa, which Jane Brooks defined as extreme thinness because of calorie restriction or purging. The National Eating Disorder Association, or NEDA, defines it as a serious, potentially life-threatening eating disorder characterized by self-starvation and excessive weight loss. NEDA provides these warning signs of anorexia nervosa: dramatic weight loss, preoccupation with weight, food, calories, fat grams, and dieting, refusal to eat certain foods, progressing to restrictions against whole categories of food, for example, eating no carbohydrates, frequent comments about feeling fat or overweight despite weight loss, anxiety about gaining weight or being fat, denial of hunger, development of food rituals, such as eating foods in a certain order, excessive chewing or rearranging food on the plate, consistent excuses to avoid meal times or situations involving food, withdrawal from usual friends and activities. In addition to warning signs, these are a few symptoms of anorexia nervosa: inadequate food intake leading to a weight loss that is clearly too low, an intense fear of weight gain, obsession with weight gain, and persistent behavior to prevent weight gain, self-esteem overly related to body image, and an inability to appreciate the severity of the situation. To summarize, the DSM-4 gives the following criteria for being diagnosed with anorexia nervosa: a body weight of less than 85% of what it should be, fear of fatness, a preoccupation of body, 3 or 4 missed menstruation cycles in the case of females, and a refusal to eat. While anorexia nervosa is relatively rare among the general population, it is somewhat common among young women. In a study done in 2012 by Frederick R. E. Smink, Daphne Van Hoeken, and Hans W. Hoek on the epidemiology of eating disorders, they noted that while the overall incident rate of anorexia nervosa remains stable over the past decades, there has been an increase in the high-risk group of 15 to 19-year-old girls. This finding indicates that either anorexia nervosa is being detected more quickly or has an earlier age at onset. According to the Centers for Disease Control, in 2008, 30% of American adolescent boys and 60% of adolescent girls believed they weighed too much, though in reality, 16% of boys and 15% of girls were actually overweight by medical standards. Knowing that adolescent girls tend to worry more about their weight than adolescent boys, it is unsurprising that 90% of those who suffer from anorexia nervosa are women. Approximately 1/2 to 1% of American women suffer from anorexia nervosa. Of these women, 40% of them are between the ages of 15 and 19. All eating disorders have a mortality risk, but anorexia nervosa is the most prominent and also has the highest mortality rate of all mental disorders. Again, from the study of Smink, Van Hoeken, and Hope, they stated that between 5 to 20% of individuals struggling with anorexia nervosa die from it. The probabilities of death increase within that range depending on the length of the condition. Self-starvation leads to many adverse health effects. Some of these include an abnormally slow heart rate and low blood pressure, a reduction of bone density, also known as osteoporosis, muscle loss, severe dehydration, kidney failure, constipation, fainting, fatigue, dry hair and skin, hair loss, and high sensitivity to the cold. For females, amenorrhea occurs, which is stopping of menstruation. In March of 2015, Philip S. Meller and Carrie Brown published an article about the medical complications derived from anorexia nervosa in the Journal of Eating Disorders. They highlight the long-term health complications on almost every body system caused by anorexia nervosa, even after they have participated in a successful program of nutritional rehabilitation and have had weight restoration. Some of the health complications are shown in the following chart. I'll explain some of these complications that may be unfamiliar. Mitral valve prolapse is an improper closure of the valve between the heart's upper and lower left chambers. Lanugo hair is a downy layer of hair similar to that found on a fetus or newborn that is all over the body, including the face, that is used to try and keep the body warm. Aspiration pneumonia is an inflammation of the lungs and bronchial tubes after inhaling materials such as vomit, food, or liquid. This often occurs because bulimia, or a purging of the body of food after eating, often accompanies anorexia. Cerebral atrophy is the loss of neurons and the connections between them. In a 2016 presentation by Dr. Paul Schwandeveldt, he lists several risk factors that relate to anorexia nervosa. These include living in a culture where there is an abundance of food and an ideal of being thin, being in a middle to upper SES, being a female in their teens to early 20s, an exposure to images of beauty that portrays a specific body image, the tendency of being a perfectionist, feeling a lack of control in other aspects of life, having a peer pressure to fit in, and praise and encouragement from friends and family for being thin. Dr. Schwandeveldt stated that the biggest risk factor was living in a critical, rigid, enmeshed, and coercive family that wants to appear perfect. The influence of a mother can also be a risk factor for girls. In a study done in 2010, it was found that daughters whose mothers had extreme weight loss behavior were more likely to fast, crash diet, and skip meals. I would like to briefly discuss males and anorexia nervosa. As I was studying for this presentation, I came across a TED Talk given by Dave Chawner in February of 2015. Chawner is a comedian who has struggled with anorexia nervosa since he was 17 years old. His sketches are often about his struggle with anorexia nervosa, and he tries to break the stigma that comes with mental disorders and provide an atmosphere where people are more comfortable talking about them. Chawner admits that while anorexia nervosa usually plagues females, it also affects males. Therefore, people should be as quick to seek help for young men with anorexic symptoms as they are for young women. There are many different programs to help those struggling with anorexia nervosa. However, only about 1/3 of individuals struggling with it in the United States obtain treatment. David M. Gardner, Kelly M. Vitosik, and Kathleen M. Pike address the difficulty of the treatment of anorexia. They state in the Handbook of Treatment for Eating Disorders, those with anorexia nervosa are particularly reluctant to commit to the main goal of treatment, namely weight gain. Different treatment options include hospital-based programs, cognitive behavioral therapy, and family therapy. These programs aim to medically stabilize the patient, help them to stop destructive behaviors, and address and resolve any coexisting mental health problems that may be triggering the problem. According to Cleves and Latner, going to a hospital-based program is usually the first step in restoring a person's physical functioning. For some struggling with anorexia nervosa, they will not accept that they have a problem, and their condition usually escalates to a point where they need to be hospitalized. Netta explains, acute inpatient hospitalization is necessary when a patient is medically or psychiatrically unstable. Once a patient is medically stable, he or she is discharged from the hospital and ongoing care is typically delivered. After being stabilized medically, or if the anorexia nervosa has been detected early enough, cognitive behavioral therapy seems to be a logical option for treatment. With anorexia nervosa being a mental disorder, cognitive behavioral therapy tries to help the individual change their perception of being too fat. Gardner, Vitosik, and Pike gave 3 phases of cognitive behavioral therapy. The phases are building trust and setting treatment parameters, changing beliefs regarding food and weight, and preventing relapse and preparing for termination. According to Gardner, Vitosik, and Pike, cognitive therapy can take several years to be effective. The treatment that is most effective in treating anorexia nervosa is family therapy. Family therapy addresses family issues that may contribute to or be caused by the problem. There are also 3 phases in family therapy. In the first phase, parents, with the help of therapists, are responsible for ensuring weight gain and limiting destructive weight control behaviors. In the second phase, the child or adolescent is helped to take back control and responsibility for their eating habits and weight. The third phase is focused on maintaining the weight and having a healthy development. In a study done in 2015 by a group of family therapists in the United Kingdom, multiple families were brought together for group family therapy. They spent 4 days going through different sessions, ranging from eating together as a family, having open conversations where the parents were able to discuss the impact anorexia nervosa was having on the family, and setting goals for the future. Claire, an adolescent participating in this family therapy, wrote on the first day, "I started believing I have a problem. I was surprised because I thought that there was nothing wrong with me. I just thought I had an obsession with dieting." In this study, 94% of the parents involved were successful in encouraging their children to eat. What seems to make family therapy so successful is that it recognizes the influence in the home, gives parents tools to help their adolescent in daily interactions, and builds a network of caring adults for the adolescent. Currently, there are not any preventative programs for anorexia nervosa, only intervention. Prevention is best achieved by reducing risk factors and enhancing protective factors. This can be done by modeling a healthy self-image, having a warm and accepting family culture, and by starting at a young age, having open communication. Thank you for watching this presentation.